Hi, it's Dr. Epstein. I'm here with John, who is now almost 14 months post a single procedure, 3,073 grafts. And let's take a look, and you can see, basically the kind of coverage he has. Put your head down like that. Let's put like that. He's gotten some nice growth. He didn't have incredibly thick hair, but you get the overall appearance of what he had. He basically had really no hair to begin with. And his donor area, let's come over here, is, if you can find it, is right there. I mean, just the smallest, finest of scars.
Wow, I actually can't see it.
That's the cameraman talking.
Yeah, sorry. Hi.
So wait, John, tell me a story about the derm. You saw derm, what happened?
Yes, a couple of months ago, Dr. Epstein, I had an occasion to visit a dermatologist, and I mentioned to him that I had, in fact, had a hair transplant just less than a year ago. He inspected the top of my head and was quite surprised to find no scarring. He said it was the only time he had ever seen someone post-op hair transplant with no scarring on the top of his head.
Well, that's a nice story, isn't it? anyway, what we talked about with John is he wants more coverage now. We had planned all along, let's go ahead and give you some nice good density in the frontal, 2/5 or so, up to half. And what we're going to do with this procedure is we're going to bring up his sides a little bit, and then we're going to really fill in, probably get back to around here with some nice coverage, sort of continue this. Second procedure would involve probably around 2,800 grafts. Typically, I get around 15% fewer hairs with the second procedure, but I mean, obviously he's happy, and if you decide not to have any more work done, it still looks good. Any last words?
Dr. Epstein's the man. And you are. I really mean it.
And I would